Hi, I'm Laura Oswald. I'm an assistant member in the Department of Health Outcomes and Behavior at Moffitt Cancer Center. I'm here at SITC in Boston, and I am presenting a poster titled Racial Ethnic Differences in Treatment of Advanced Non-Small Cell Lung Cancer with Immune Checkpoint Inhibitors. And this is an analysis of a large real-world data set. So essentially, we were interested in determining whether there were any differences by race and ethnicity in terms of who's selected for treatment with a checkpoint inhibitor for advanced lung cancer. And we were fortunate enough to be able to leverage Moffitt's relationship with Flatiron Health to get access to their gigantic de-identified EMR database of patients from all across the US, mostly treated in community oncology clinics, to be able to get at some of our questions. So in the end, we ended up with data for more than 50,000 patients with advanced non-small cell lung cancer who've been treated over the past decade. And using this data, we were able to explore patterns in race and ethnicity and treatment with checkpoint inhibitors. So some important things to note. First, we split the sample in a couple of different ways. We split the sample by age, looking at patients who were less than 65 years old, separately from patients who are 65 and older, because we knew we wanted to account for insurance status in our analyses, and Medicare eligibility at age 65 can kind of throw a wrench in that. We also split the sample by year of treatment. So we looked at patients who were treated before 2015, separately from patients who were treated after 2015. 2015 is when the first checkpoint inhibitor for advanced lung cancer was approved by the FDA. So we kind of used this to approximate patients who were treated on clinical trials before FDA approvals versus patients likely treated as part of standard of care. And what we found is that most of the differences by race and ethnicity emerged for older patients, 65 and older, after 2015 in standard of care practice. So we found that older Asian patients, Hispanic and Latino patients, patients who are categorized as another race or ethnicity, or who we didn't have that information for, they were all less likely to be treated with a checkpoint inhibitor compared to non-Hispanic white patients. This is really interesting. It shows that there's still a lot of work to be done in terms of who these treatments are offered to and who's going on these treatments in standard care. I think encouragingly, we did not find any disparities among Black and African American patients, which is an important step forward. So we are working on some follow-up analyses now to try to get at the why this might be happening and exploring some mechanisms that might help explain some of these patterns that we're seeing.